bill do to companies that offer their employees good health insurance plans? Michael Cannon is the director of the health policy studies at the Cato Institute. Michael, I want to play something that the president said while he gave this speech right before I believe he was called a liar. He gave a speech on the health care plan, and this is what he said. Watch.
If you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Let me repeat this. Nothing in our plan requires you to change what you have.
Got it? Nothing in this bill, keyword, will require you. They may nudge you in there with a slight 40% tax. Can you explain that?
Well, the president's wrong in a number of ways here. For one thing, he's going to make health insurance compulsory for every man, woman, and child of the United States. That means that under all of these bills, the government would have to define a minimum level of coverage that you would have to purchase in order to comply with that mandate. And there are going to be millions of Americans who are going to have to buy more coverage in order to comply with that minimum definition of acceptable coverage. So right there, the president is going to force tens of millions, perhaps 100 million Americans to buy more coverage, to change the plan that they have right now.
Okay.
On the other hand, if you've got that's if you've got a low-cost health plan. Mm-hmm. If you've got a high-cost health plan, the president's going to slap a tax on that. He's going to make you pay a 40% tax on the premiums that exceed a certain threshold. And it's not just rich people like you, Glenn, with very generous health benefits who are going to be hit by this tax. A lot of people have high health premiums because they're sick, and they are going to be hit by this tax. Okay. And there are other taxes in this bill specifically targeted to sick people.
Let me go through this. This is not about you, certainly. It's really not even about government-run health care. It's not about health care or the employers or anything else. This is about one thing that we have a shortage of, and that is money. Because if I understand this, and Michael, help me out on this. If I understand this right, I give my employees that work for me and my company all benefits. You have vision, you have dental, you have no deductible. You have the best insurance money can buy in the state of New York. I can't buy any better. It's costing a fortune, okay? I have no problem. I treat my employees right. But that's going to be, all my employees are going to lose that because I'm going to be taxed up to 40%, right? For everything that I said, everything I already do, I'm going to have to pay the government another 40% in taxes. So they know employers won't do it because I go out of business if I do that. So what happens? They can give you, the employer will then say, well, you just go and get that money for that insurance from the government, right? Isn't that kind of the plan?
Well, it's not quite that straightforward because it's not clear who is going to have access to that government plan. But what the incentives would do is encourage you to change your health plan, do exactly what the president says he's not going to require you to do. But he's just going to hit you with a 40% tax on your premiums above a certain threshold. But everybody knows that that's going to get employers to change their health plans. That's the whole purpose, in addition, by the way, to taking some of your money.
Let's just say this, though. Let's say I'm giving something that's worth $12,000 a year, okay? If I stop giving that, then my employees are going to say, you know what, it was costing you $12,000. Why don't you just give us $8,000? Okay, we give that $8,000. This money is now taxable to the federal government, is it not? Because I'm giving them a raise. So they're getting money, they're getting tax dollars that they weren't getting before, and they're getting you into this system. They win all the way around.
If you try to avoid that excise tax on high-cost health plans by reducing the amount of health benefits you offer and giving that money to your workers as salary, as a salary bump, then yeah, it's going to be taxed that way too. So they're either going to tax you coming or going.
Yeah. Isn't that interesting? But remember, America, this is about you. All right, Michael, thank you very much. Keep watching this for